Assalamualaikum. Hello and welcome to Beyond Conversations with Sehar. I'm Sehar, your host and founder of Beyond Talent. In this space, we share stories, unfiltered moments of our leaders and what has shaped them today. Today, I'm really pleased and honored to be joined by Dr. Iman with us in this episode. Dr. Iman is a medical doctor with nearly 15 years of experience in general and emergency medicine. She's been in Bahrain healthcare for over a decade and she believes in empathy, dignity, and deep commitment in humanizing medical healthcare. She ensures every patient has an experience built on care, connection, and respect. In 2022, Dr. Iman went through a very challenging experience in her life, which changes her perspective on life, personally and professionally. Beyond her medical career, Dr. Aman is a certified trainer, mentor, and an active voice in supporting women in leadership and personal growth. Thank you so much for coming, Dr. Iman.
وعليكم السلام شو أخبارك؟ شلون شي سحر؟
Alhamdulillah, Nazeen. As you were speaking about beyond conversations, beyond title, beyond designation, who is Iman?
At first, a human being. I'm a mom, a daughter, a sister, I'm a friend, a cousin. I am a physician. I'm an advocate definitely for to humanize medicine, and I think this is one of the stuff that I learned about me going on. I'm a taekwondo master, black belt.
Awesome.
I'm a football player, defense. I think this is one of the stuff that people don't really know, and I think some people would not want to really know. When you are who you are, and then you need to somehow have a bit of you when you have a conversation with someone you know or even you don't know. So there are stuff that people realize with time, meeting stuff that you surprise yourself. I think you surprise the other person, and that's good. I like surprising people.
So, why medicine? What drew you to medicine?
A very classic answer. Probably I think people, again, even while asking that, I may go back and say, you know what was it really? And because it's a classic answer for me and precise, since I was 8 maybe or 9, I was like, yeah, the lab coat games and being a doctor. And actually, I think I was putting bandage on everyone, all my puppets and my brother, Miskini. And he was always there. So yeah, he was one of the examples of being a good patient, and he listens because he was young. He is younger. And later on, also during high school, having a sense of trying to help someone who, I don't know, one of the girls in the class who is coughing or having a headache, or the teacher who did not come for a couple of days, and you go check on her. Maybe it's a bit tricky, but then later on you realize, I was like, oh, that actually was something in healthcare, something in care. It's one of my values is trying to care and actually help. So it went together.
So it was inside you, deep inside. And how do you feel like this profession is quite demanding? So what is something people don't see in medical?
I don't want to be dramatic, let's say, from that sense. I enjoyed university. And this is something actually students and whoever not in healthcare, and sometimes in healthcare services or profession, they seem to tend to be very firm in how university is going, how studies. It has to be by the book. It doesn't have to be by the book. It has to be what you really believe in, what you're studying, and you're taking it from there. The first stuff that literally will hit, I believe, an intern or someone who started to do the night shifts, that you're the only one in the department or that floor that you need to take care of. God knows how many patients, depending on the hospital. But then, no, it's on you. Yes, you do ask whoever is superior or senior, but there is this intuition somehow and fear in your heart till the sun comes. You go like, it's done. And this is one of the first things that definitely you can't get prepared. You're responsible to yourself, and those patients are responsible to you, although if you have seniors, but that
going to be a real experience.
It is خلاص, you're dealing with you're one-on-one with other patients in that floor, let's say, or in that department, and the nurses will call you, and you have to sign on some medication sometimes, some stuff that you know, but you're not sure. Something we don't learn it in university, that it's not a one-man show, because surgeons would say a surgery is a teamwork, yes, but even in the medical specialties, even in emergency, you have a backup of nurses, of practical nurses, the radiographer, the lab technician, even the person who's bringing you tea, believe me, that's a support to finish that 7 or 8 hours. And you don't realize it until you start doing it. Even if you hear or learn stories, it's not the same. Until you're there, it's not the same.
Wow. Speaking about late night shifts, challenges, as a woman, do you feel it is hard to be in medical, and what challenges did you face?
It depends. It depends what you're doing in medicine. I know the known things that some specialties they're easy, some specialties they're hard. It demanding rather than the word hard, yes. Would you be able, or is it one of your goals to be able to give all of that, your time, your energy, your emotional strength, and your presence to the field or to the practice itself for more than 8 hours per day? Would you tolerate it and you're going to be productive in it? Or would you say, you know what, I love it, but I can't anymore? And it's not because of you don't know, it's because of you now you know what to choose. And I love surgical departments and surgical specialties, and actually I wanted to do one of the specialty, and I think alhamdulillah, my patients probably till now, whoever I treated before in that specialty, they still know me, because it's one of the specialties that we don't have much of females internationally wise. And that's another story. So but then reaching to do some exams and knowing that you finish your operation theater, it's okay, you're not gonna be like finishing after 3 p.m. But then because of my personality, I'll be staying a bit more, and I'll be checking on the patients, and that started to take time from, I have 2 boys, that started to take time from them, and they were at that time a bit in the younger generation, primary age. It's not nice.
In medical field, staying late, working in shifts, how important it is to have a family support.
It's one of the, as a woman who not easy. I was like, maybe other physicians, the one I have, it's alhamdulillah, it's a harmony, you know. And I keep telling sometimes young couples in medical fields, I was like, you're married to a physician or a nurse or whatever the specialty in the medical field, it's not complementing each other, it's rather than walking parallel. Each has his own path with intersection point that you agree on. And this is where the support system comes. And this is where you also understand to what extent you're able to do stuff by yourself, and to what extent you say, you know what, la, I need help. But female, usually they don't ask. So exactly. I learned that late. And I learned that miraculously needing help, asking for it, is an add up to me, rather than it makes me vulnerable and not able to do. It's not that at all. I need help to do what I can do on the most perfect way I want to do it, whether time with the boys or time to the clinic or to the patients or even to the educational part and to me. And this is where I think women try to do and to be an octopus like you can do more than 2 or 3 tasks. It's okay. But it's different.
We wear so many hats, and I'm sure as a woman you do agree that we can do anything we put our mind and heart into, whether it's family, our career, our friends. Alhamdulillah. As a woman in medical, do you feel like there were any challenges you faced?
On the professional scale, depending on what specialty you want to do, honestly, let's say from not from the academic point of view, rather from the environment and the community point of view.
Yes.
And I know male would have something similar in a specific specialty, but it's only that. For women, because of even our size is small, so some patients would actually ask, "Can I talk to the big doctor? Can't have like I don't have a big doctor," and they're like, "Okay." And this
They judge
definitely
you.
they prejudge and judge, and this actually can be can has like two sides. It can encourage you to have to speak up and have let's say the a bit louder voice to explain, and it also depends on where you are in your career. Can just drop you
Pulls you
down,
down,
yeah,
yeah.
drop you down, and you feel like, you know what, I'm not good enough, or no, I need help always, and that plays and triggers on the self-trust. On the professional scale, to say as a woman anything would limit us, no. If you want to do it, you can. It depends on what's your aim out of it, you know. The path will be definitely
Difficult.
struggly and wiggly. In medical field, I learned something, and I like to say it, we don't like a straight line. A hard straight line that kicking. But then
Exactly.
depends on how the bump is, how normalized it is, and how hard it is. So those waves are very good, but you need to know those waves, where are they gonna take you, and how you're gonna deal with it.
Beautifully said. And I do believe it's on us how much we are willing to take, how much sacrifices we are willing to make. And that is what keeps us going. And if you're not ready for it, then it's not for you. It's as simple as that.
There you go.
Coming back to our questions, and I would like to know your personal experience in 2022. You went through a very traumatic phase of your life, it was a turning point. How did that moment shaped your thought process? How did it shaped your
Um,
life?
I think I may be the person who had an incident, but it's not as big as a lot of people. Let's make it in that point, because I know other females or other women had struggle and turning points humongous, but because of these incidents are very personal, and whatever, like the incident of a brain stroke makes me feel and say reversely, what did I say to my patients? It's okay. It's not okay. We try to ease it up sometimes, but utilizing not not correct word at that moment, because this is what a physician would try to do, and ease it up on the patient, try to not minimize, but make it smoother, the transition of where you are and what's going to be in medication. And no, it's not, it's not okay. It's not okay not to be able to move adequately and with coordination. It's not okay to not be able to hold a cup with your left hand rather than. I'll tell you what, my dad stayed, and if he hears me, he stayed handing me stuff with my left hand until 6 months or 9 months after it. Although I have full strength, khalas, but he kept doing that over and over. That is very heartwarming, because you see the care, but also you see the fear in the other party eyes.
Exactly.
Your loved ones, you can see maybe they're not going to talk, and they will tell you, it's okay, let's do this, or we do an exercise, whether in the water or outside. But going back to this, was it a struggle 100%? It was a mental struggle more, let's say, than physical. The physical wore off. Person who would ask for help always, but at that time I had to ask my youngest to shift me and move from a living room to my room. Although it was funny, so I tried to make it as a train. But then going backwards, it's not as easy. No.
So what really helped you to recover in
Oh,
that time?
I went to reading all over again. I did like lots of academic stuff while just something also and stuff later on. Although in COVID time, I think it was a phase for me to understand a lot of stuff. But then going back to the recovery, it's not only reading, it's knowing where is your faith exactly. Okay, and my name is Iman, so it's in English, it's faith. But then
Inshallah.
even that, it's different when it's in front of you in your hands, and you want to know, then what next? What is it
Next.
exactly? We do ask this question to ourselves: what's my goal in life? Okay, يعني إحنا alhamdulillah, we're all on this land or on this earth for a reason. We may not know it now, but there is a reason why you're there. It's not just to like shift TV and be you're a
Exactly.
higher creature. So higher creature
Totally
means
agree.
you have your brain to utilize it. So yeah,
So proud of you.
thank you.
And so good to see everything is fine. Alhamdulillah, you're here.
Alhamdulillah. It's a blessing. Alhamdulillah.
Alhamdulillah, it's a blessing. Even to have family, friends, your kids, it's amazing.
It teaches you. I have a backbone,
Yes.
and I believe us for our parents. We think that we're supposed to be their backbone, growing in age, and suddenly this happens, and it goes. You will know the core of that human being with this. So it's not being a husband and wife only, it's being the friends, it's being all of it. And what you raise, and also that you'll see it with time, and what you
Yeah.
choose, because sometimes even friends, they come along and you don't realize how close you are until stuff like this happen to you or to other. And alhamdulillah, I hope no one have
It's a
anything.
time for self-reflection, and
Oh,
you
totally.
actually got to know, like, how important these people around you are.
Yeah, totally.
Alhamdulillah. Coming back to you, I would like to know about your initiative about Isbitar and what values do you bring in and what was the vision behind it. I would like to know everything.
Okay, it's like you're telling me about something very very dear to me, because Isbitar is a mobile clinic. It's a
Wow.
clinic on wheels. It's a full clinic setup. There will be a doctor I'm going to be on board, and a nurse, and the driver, of course. So the full clinic will move around, inshallah, Bahrain, providing healthcare
Inshallah.
services to the people, whether in-house or even to corporate or students and so on. So it's actually bringing care to the patient where they are, rather the other way around. So COVID time, I was working in emergency department, and I was in emergency COVID. We had a semi department for emergency COVID patients. With time, I realized that a lot of the elderly population came, but not for COVID reasons. They just came to fulfill their prescription or for their regular checkups. And even if they're in distress, it's still not the place to take, in the sense of, because we have two population, whether COVID
Exactly.
or not. And the time took a bit longer than it's supposed to be because of the event of COVID. So I tried to seek later on, like some studies and articles, to understand the population we have in Bahrain, what's the percentage of older person, and older person means above 70, 73 plus. Because sometimes I see patients, or even people, or relative friends or family, they're like, yeah, I'm getting old, and he's 43. I was like, no, you're not getting old. It's beyond that. But sometimes it's a physical and mental state where a person would be feeling that old because of whatever medical issues he has or she has. So that population, already as initiatives in Bahrain, we have, alhamdulillah, a lot of good things in the medical and healthcare from the Ministry of Health, but yet it is not as enough, and it is a burden to them. So the aim, or let's say the target market, is that population, but yet we're also servicing or giving service to the general population. I was asked once, they were like, are you going to come if I call? I was like, it's a service. So it's a clinic. Let's say you're going to pick up a phone, you call a clinic, and you can pick up a phone and call a Isbitar for an appointment. It's to make you a bit more comfortable.
So when are we expecting it?
Hopefully, inshallah. We're in mock-up, and soon we're manufacturing, launching there. But then, alhamdulillah, regulatory paperwork.
We're looking forward to it.
Inshallah.
Talking about leadership in healthcare, do you feel it's important to have leadership qualities, compassion in healthcare?
Definitely. It's one of care, whether a woman or a man, let's say, from that standard first. But then women leadership nowadays in healthcare programs and in healthcare sector itself in Bahrain, mashallah, alhamdulillah,
Shanna.
our minister is a woman. So يعني to say that, I think
Alhamdulillah.
that maybe will what we have behind that, and also the thoughts above that. So it's not only the minister,
Exactly.
it's the full community from our leaders, alhamdulillah. There is a thought and there is a program and initiation for female in positions. One of the stuff that I also learned, I think, with time, my head of department used to be a female. That's important.
I'm sure you learned a lot from her.
I learned a lot to do, and I learned a lot of stuff not to do.
Wow.
And I know if she hears that, she knows well. She knows that. She knows me as a personality, and she knows her at his position. And I think some personalities think that we're fighting over the place. It's not that. And this is where the leadership shows up, that you're having a harmonious team, and each has his own or her own skill. You're in a community that you try to live all together, and you bring the best quality in you. So if someone will be able to see that female have that sixth sense, then you can see the qualities. And sometimes in accountants or finance or whatever specialty, I may see a quality that person has, but unable to formulate and skill it up and show it and utilize it. And this is why we're moms.
Exactly.
This is subhanallah. And God wrote this blessing on a female to become a mom because she's able to.
She's able to do so much, handle everything. Yeah.
I do tell though women and girls and students, being an octopus or knowing how to do more than a task, it's good. But then one thing, you need to know where's your boundaries. Like you do 3 tasks, that's very good. But keep track. This is where the logic of a male thing. Keep track those 3 tasks. If you're gonna do more than that, your quality of what you're doing will actually drop, and the focus and the attention.
It will lead to burnouts.
It's not worth it. This is also something I learned. It's not worth it. I had a surgeon, a head of department in surgery I worked with, and one of the days, I don't know, it was like a hectic day, a lot of stuff. The next day I had one of the boys were like a bit sick, and I needed to get an excuse. And he was like, don't worry about it. Work will go on. And I was like, am I supposed to cry now? Really? For you, when you do something and you work, you feel like you're the one who's driving it. This is why it's a teamwork. You're not you're driving what you can, and you're driving the tasks.
It comes to humanity end of the day.
There you go. And I was like, okay, I'll see the patient tomorrow. And then to take it, to digest and understand the meaning behind the words. That's so not a test. How do you say it? That's a lesson to us, and to know. You know what? This is important. But then this is a bit more important.
As a woman, we tend to take so many roles, responsibilities, and
we like that. I know, it's
we love it, and then we get overwhelmed, and they're like, crash out.
Not worth it. Why? Not because the work not worth it, or the person, or the state of. It's not worth it because if you want to consist and be sustainable in that post you have, or that position you take in family or in outside, you need to maintain your own physical. It's the whole mental, physical, emotional. They should be very true.
So, talking about healthy boundaries, was there any difficult decision you had to take, like whether in medical, in personal life, and how do you feel about it?
I learned to let go of more or less we get attached to places and humans.
Exactly.
And regardless how close that human being to you or that place, if you keep trying to pull it to you, it will not work. It will not have the core of the relationship or the attachment, but then you're getting beyond attachment. Even the relationship will not have a meaning even to you with time. So and you keep you keep pulling 2 sides, but then because we're human beings, not everyone has the same personality as you. Not everyone will ask for help. So you want to help, but it depends on the other party. How are you going to take it? So if they don't want your help or they did not ask, why are you going to burn your brain for it? So leave it. Not letting go of the core of the friendship or relationship, but just let it be. It will heal by itself without you keeping to drag here and there. And even places, it's difficult, I think. We are, let's say, raised traditionally.
Exactly.
We are grandparents. They're the people who are raised during the 50s, 70s, and 60s. I flipped 50s, 60s, and 70s. So that is traditionally raising. This is where you do everything for family, and you have to be an A+ student. And sometimes robotically you do that, but you don't need it anymore. And to detach from that type, it will take time.
And even you don't feel anything. You don't even feel full. And you're doing everything right.
Yeah, true.
Wow, that was a conversation. As we gently move towards ending of this podcast, which I don't want to do because we're having such a good time, I would like to know, what message will you share with the women, with the girls, young girls who are watching you, who wants to grow in their career, wants to balance their life, their personal lives? What is something you'd like to tell them?
Knock not only the doors, literally knock every single path you find. Because behind the curtain, behind the window, you may find an answer, but you need to have the initiative. It is scary. It's scary to take a risk, to talk to someone you have never seen, you don't know, and you're going to ask for money. So let's say this is a level of another level, but then that is there since we are
Keep your mind open.
Keep your mind open. You'll get rejected for whatever reason. That's not because of you. It's because of the situation itself. Don't take it personally. If you take stuff personal, you're the one who's going to be walking on a treadmill. So you're walking without movement. So you need to move forward on, or even backwards. Just the movement that you need to start, and progression rather than just
trying again and never giving up.
Over. If you believe in something, over and over.
That's a great message. Thank you so much for your time, Dr. Iman. It was a pleasure having you with us today.
Thank you, Sehar. Thanks a lot.
Thank you.
It was a pleasure, and I feel privileged to be chosen among the women in different other fields. And thank you. Shukran.
Thank you, Dr. Iman.